Hello, I'm Ramon Stewart, and I'm the president of Clayton State University. I'm so thankful to have this group here on campus with us today as we start to go through and talk about with our expert panel the many things that we need to do to make sure that we are all safe during this COVID-19 pandemic. Whether it be mask wearing, vaccination, or continued testing, we all must do our individual and collective parts to ensure that our world and our society is safe as could be. And when we think about that safety, we all have to pause and think about those who've gone before us. And I think about on my selection, the day I was selected as the president of Clayton State University on June 1st, I also paused at that particular moment because my mentor's daughter took her last breath. She took her last breath because her underlying health conditions would not allow her to actually take the vaccine until the month of June. Well, she only made it to June 1. Ladies and gentlemen, as we come together today to talk about this important initiative, please know that we want you to make it. We want you to survive. And so we are going to do everything in our power to make sure that you have the education necessary to be safe and to continue to be blessed as you are a blessing to others. Thank you and welcome again to Clayton State University.
My name is Dr. Lenore Coleman, president and founder of Healing Our Village and Total Lifestyle Change. And we're coming to you live today for those who want people in their family or their church or their community or their co-workers to actually see this broadcast. It will be available up on our YouTube channel and also on Healing Our Village website, which is HOV Health.com. So again, I'm so glad that those of you are out there watching. I know we sent this out relatively quickly this week, but you all came and to watch us today for these amazing speakers. So what I'm going to do is just jump right in. I promised the panel I wasn't going to keep them here all day. And so what we're going to do is we're going to introduce our first panelist, Dr. Suta Reddy. She's first up here at the table. And she is the Chief Medical Officer of Clayton County Fire and EMS in Clayton County, Georgia. She attended Morehouse School of Medicine and emergency physician and has practiced emergency medicine in the area for a number of years, 20 years. So this is, again, this whole panel has been at this for quite a long time. She's also a master in public health and epidemiology and international health from the Rollins School of Public Health, Emory University. Most recently in 2020, she completed her training and became a certified firefighter in the state of Georgia. So Dr. Reddy, I'm going to ask you to come up to the podium here, and you're going to give us just some remarks. In terms of, just so you know out there, the panel will go Dr. Reddy, then Dr. Satcher, then Dr. Gavin, and then Dr. Bentley. So we're going to start off with Dr. Reddy. Come on up, and thank you so much.
Okay, good afternoon. Thank you so much for the opportunity to sit with an amazingly illustrious panel with some of my alma mater as well. I am Dr. Suta Reddy. I am the Chief Medical Officer of Clayton County, as I was introduced. This is an extremely unique position I am the only Chief Medical Officer full-time for any fire department or EMS in the state of Georgia. I started in early 2020, actually January 1st of 2020. My discussion will have some numbers, but I also wanted to take some time to highlight what that means at a very local county level, because this has been a journey for myself, for our department, for our partners in the county to mobilize and address truly a pandemic that came from nowhere. The county itself has had approximately 634 deaths from COVID. This becomes very significant, and I go back to the risk factors and the population that we serve. 634 deaths have occurred in this county. However, there have been approximately 3,700 total deaths in the state. It means that approximately 17% of all deaths in the state have come out of this county. That is not okay. That is not acceptable, but it is reflective of the risk factors and some of the struggles that we have faced at a local level with hesitancy, with distrust. And we as a fire department have utilized our pivot to try to have those conversations, to try to support both in an emergency management, but also to support our partners. The vaccination rates are slowly ticking up. As you know, the majority of vaccinations in the state, there's approximately 10 million vaccinations that have been given in the state. 6 million of those are Pfizer, approximately 4 are Moderna, and the rest, 250,000 were Johnson & Johnson. The numbers in the county, I believe, also support that ratio of 60% being Pfizer, 40%. We are up to 242,000 immunizations have been given. First dose, 130, and which puts us at 46% first dose vaccination within the county. And then our second dose is 114,000, which is about 40% of the county have received full immunization in a population of approximately 280,000 in this county. These numbers are much better than when we started, than February, March. We're making headway. This includes our 12 and overs, includes our partnership with Clayton County Public Schools, who have done a fantastic job of utilizing their nurses and partnering with the Board of Health to have mass vaccinations. So these are all the things that we are doing at a very local level, and I cannot say enough. So that is what I will say. Thank you so much for the opportunity to speak, and I will pass it on to my next panelist.
Thank you so much. That was excellent.
Dr. Satcher is the founding director and the senior advisor of the Satcher Health Leadership Institute. It was established in 2006. He's the 16th Surgeon General of the United States. That was in 1998 and served through 2002. Then he's the interim dean of the Charles R. Drew Postgraduate Medical School, and I wanted to say that because I'm from Los Angeles, California, so originally, so that I know and have many friends and faculty that are still at Charles Drew. Director of the Centers of Disease Control, served on the World Health Organization, which is really important because I think we lose sight of the fact that this is a pandemic and that is affecting people all over the world. He has been a Macy's Foundation Fellow, a Robert Wood Johnson Foundation Clinical Scholar, and a Senior Visiting Fellow of the Kaiser Family Foundation. And I could spend the next 30 minutes going through the resume and the bio. It's extremely impressive. I'm really honored that Dr. Satcher agreed to come today. But the other thing I think you all need to know is he actually lives here in Clayton County. So, you know, he is actually a person that is really part of our Clayton County family, and I want to thank him so much for coming.
I'm delighted to be able to join this very distinguished panel to talk about a problem that needs more attention than it has received. And that's what I think we're trying to do today, is to give it more of the kind of attention that it needs. There have been a lot of good things about this pandemic, but there also have been some troubling developments. And let me just point out a few things. Currently, the COVID-19 pandemic continues to spread and is a major cause of death in our country and beyond. 700,000 deaths in this country and over 4.5 million globally. As of the past week, a little over 55% of Americans have been immunized with vaccines that appear to be over 95% effective. That's the good news. And perhaps the most positive development has been the development of these 3 vaccines that are effective in significantly containing the spread of the virus. African Americans are increasingly taking the vaccine, but continues to lag other groups. The need for more credible voices is still very real, as you've heard. African Americans continue to mistrust the federal systems, including law and health care. In fact, I was mentioning to somebody earlier that when I went to the CDC as director in 1993, we had a problem with children being immunized with measles, mumps, and rubella. And so we went out and recruited community leaders, especially pastors, to help us to communicate to parents the importance of immunization of their children. And it worked. We went from around 30% of black children being immunized to 5 years later, almost 80%. I remember Detroit being one of the worst cities, and by the time we finished, Detroit received the award for most progress in immunizations because of the work of their mayor and the church groups there. In my role as director of the CDC for 5 years and Surgeon General for 4 years, I came to appreciate the rigor of work at the federal level in evaluating drugs, and especially the work of the FDA, Food and Drug Administration, but also the work of the Immunization Advisory Committee, advising the CDC. And as you know, in most cases, the CDC has to give the final approval. And so there is that advisory committee that plays such a key role. So I came to appreciate the rigor that went into those decisions. And it's appropriate that that kind of rigor would be involved in approving a vaccine for children especially, but for people in general. And the big difference here in terms of my experience is that children have not been the main focus because of the nature of the pandemic. But I think before it's over, children are going to increasingly be the focus, and some of us are pushing that right now. So we've come a long ways in this pandemic. It's not always easy to say where we are in terms of stopping the spread of this virus. We know that we still have a lot of work to do. We certainly need to get people excited about the vaccine. All indications are, in my experience, that vaccines are probably the safest and effective medical intervention which we have, and I'm including all kinds of medications. When you look back in history, vaccines have made a tremendous difference, and it's unfortunate that that for various reasons, a lot of people are not taking this vaccine. I hope that's going to change very soon, and we need to work together to try to get that to change, because I think if we're able to do that, we will be able to curtail this pandemic. I look forward to our discussion again with this distinguished panel. Thank you.
Our next panelist is Dr. James Gavin, a close colleague, friend, mentor of mine. Dr. Gavin is one of the leading African-American endocrinologists in the world. He's a clinical professor at Emory School of Medicine and the Indiana University School of Medicine in Indianapolis. He is Chief Medical Officer of Healing Our Village and has worked with the First Lady, Michelle Obama, on partnerships for a healthier America. He's past president of the Morehouse School of Medicine, past president of the American Diabetes Association. He was actually voted Clinician of the Year in Diabetes by the American Diabetes Association in 1991 and is the past chairman of the National Diabetes Education Program. Dr. Gavin is considered worldwide to be a renowned expert in diabetes.
I'm truly delighted to join this distinguished panel today to talk about this most urgent problem, one that really deeply affects communities of color in general and particularly our community here in Clayton County. Because the COVID situation really reveals a surprising lack of tone of urgency. There is no real sense of emergency, and at no time has there ever been a greater need for that kind of sense of urgency and a need to rally and generate an emergent response than we have right now. The scale and the scope of this problem, of this pandemic, is enormous. And let's put it in perspective. If we think about the total number of recorded deaths of U.S. citizens in World War I, World War II, the Korean War, the Vietnam War, the Iraqi War, and the Afghanistan War, all combined, the death total from those wars was just over 518,000 U.S. citizens. Indeed, the total recorded deaths in the entirety of the Civil War in this country, which spanned from 1861 to 1865, was only about 700 deaths. Now, I'm not celebrating or minimizing the numbers, but the fact of the matter is that we have had over 750,000 deaths from COVID in the span of 2 years in this country alone. That simply gives you some sense of the scale, the scope, the severity and devastating impact of this disease. So the fact of the matter is that there is a huge disconnect in the face of a virus that is deadly in its impact in our community especially. And when we think about the impact, the effect of viral infections generally in the presence of comorbidities that include things like hypertension and diabetes, especially uncontrolled diabetes. Indeed, uncontrolled diabetes and obesity are two of the leading causes of increased mortality in people with serious COVID infections. Now, chronic obstructive lung diseases, asthma, cardiovascular disease, liver diseases, cancer, HIV, and kidney disease are all comorbidities that make COVID outcomes worse. And these are, in fact, many of the comorbidities that run rampant, that are common in our communities. Now, it is important to note that African Americans have infection rates approximately 80% higher with COVID, hospitalization rates 90% higher, and mortality rates 70% higher. Why is it that this virus is having such a severe impact in our communities? Well, it's likely attributable in part to having jobs that increase our exposure and our risk of disease, such as frontline jobs like drivers, clerks, cleaners, receptionists, intake clerks, sanitation technicians, and so forth. There are social determinants of health that actually increase our vulnerability and exposure, like more crowded living conditions, less access to health care, less access to comprehensive, in-depth educational and public health information. And there are barriers that we impose on ourselves, not the least of which are these misperception and the constant misinformation that we hear in our communities. And I'm greatly disturbed, for example, when I hear about the comparisons between the COVID vaccination and the Tuskegee syphilis experiment. There is no comparison here. That particular misfortunate instance of violation of medical ethics in history was a situation where the government withheld medicine that was proven to be effective in curing a disease that these citizens were affected by. Here, we're not talking about that at all. We're talking about people being begged to take a proven intervention that will be effective in avoiding the serious outcomes of this disease. No comparison whatsoever in terms of what's at stake. And what we need to do is to generate a sense of urgency. Make sure that we have our issues focused in the right direction. How can we turn the corner? How can we curb the impact of this disease? We need to have a concerted, uniform, and urgent approach if we are to relieve our communities of the devastating burden of this COVID pandemic. And now is the time to do that. Thank you very much.
Our last panelist is Dr. Helena K Bentley. I've known Dr. Bentley for about 5 years, since I've been here in Georgia. She's a practicing pediatrician for over 32 years. She graduated from Georgia State University with a BS degree in biology, and then graduated with honors from the University of Florida School of Medicine. Did a pediatric residency and training at our own Emory University, and is the founder and medical director of Kid Care, right here in College Park, Georgia. Many of you out there in Clayton absolutely know her. She's your pediatrician, or was the pediatrician of you and now your children. She's most recently developed a mobile app for asthma. As you know, many of people of color, many African Americans have problem with asthma, and so she's actually come up with something called Asthma Action Hero app, and so that's assisting her asthmatic patients in getting their asthma under much better control. So she's going to come up and talk to you about all of you parents out there worried about your children going to school, worried about the vaccination, should I not? She's here to answer those questions. So for those watching on Facebook, this is your opportunity to get those questions in so we can make sure that she addresses those questions.
Good afternoon, everyone. My name is Helena Bentley. I have been practicing in pediatrics for the last 30 plus years in the same community, working with children because that's what I love to do. That's what I'm called to do. I really appreciate you choosing me to be on this panel with your esteemed guests. All of them are special, and just being on the panel makes me feel special as well. Make me feel like I'm a smart person. How about that? That's so awesome. So praise the Lord. So we are here to talk about COVID vaccines, and in particular, I'm here to talk about COVID vaccine for children. Being in this country, we feel like we have the freedom or the right to do whatever we want to do. And just because we have the right does not make it right. I think everybody needs to understand that. Just because you have the right doesn't mean that what you have the right to do is right. We are here as a people to support one another and hopefully to continue on this planet healthy and whole. And we need to take care of one another. And that's what the vaccines are for. No one was able to predict, well, some people may think they were able to predict, but no one was able to predict this pandemic and the extent that it has taken its toll in the world, because we have evolved. Well, that evolution means nothing if the people that we're trying to serve is not willing to do the things they need to do to protect themselves. We had a lot of rhetoric out there. Most of it was political. I don't believe in this. I won't do this. The messages were mixed, and people got confused. And it's understandable to get confused. However, if there is something that's going to help me to stay healthy, to be better, then I think I'm going to err on the side caution and do what I need to do to protect me. We've heard misinformation about the vaccines and what it can do. It can make you a zombie. Well, we all know that makes no sense whatsoever for anybody to say that kind of stuff. But what's worse is somebody believe in whoever said it. That makes no sense to me. Over 1 billion vaccines have been distributed. Millions and millions have been given. No one has turned into a zombie yet. So I don't know where that information came from. I think we need to understand that this pandemic is not going away until we either get the disease and risk death or get vaccinated. You have to build up immunity, and there's only two ways to build up immunity, and that's passive or active. Active is get sick. We don't want to get sick. Passive, you can get passive immunity through vaccination. You also, they've been talking a lot about the herd immunity. Well, that's all well and good, but you still have to be exposed. You have to be exposed in order to get your own antibodies to fight it off. Children need to go to school. Virtual school was all right for a few weeks, but after a few months, these children are suffering. Going to school is not just about academic development, but it's also about social development. Children need to be around other children. Children need to be around other people so they can learn how to socialize, so they can develop and become active leaders, active members of our community, so they can become the scientists of the future and develop ways to predict a vaccine before we even get it and be able to nip it in the bud so 20, 30 million people are not dying because of a virus. And we hear in pediatrics a lot, parents come in, oh, my child has a fever, my child has congestion, oh, it's just a virus. Well, we don't say that with COVID anymore. We say, yes, COVID is a virus, but we don't say it's just a virus. So when people hear of viruses, they think it's something mild, like a cold, like the stomach flu. However, this particular virus is more deadly than what we've seen in over 100 years. And it's a way for us to prevent it. It's a way for us to lessen the severity by just doing the right thing. Get vaccinated, wear your mask, social distance. If you have symptoms, stay home. Don't deny it. Or don't try to hide it and pretend like you don't have anything. I think that helps the spread. We have people, they know they're sick. They have a fever, they're coughing, they have body aches, but they still want to do what they want to do. Go to the club sneezing, and you infect everybody in there. We have to understand that we as individuals have a role to play in saving the world. And one of the roles now is to protect others from COVID vaccine. If you're not worried about yourself, worry about your child, worry about your parents, worry about your grandparents, worry about the teachers that got to teach your child. I've had more children now that the parents, when they had to teach their children last year, they worried more about, oh, I think he got ADHD. Well, what the teacher thought that too. You didn't worry about it until you had to do it. But get your child tested, get your child vaccinated, get them back where they need to be so they can obtain the very best that we have to offer. We in America, we got access to the very best in all the world, but we ignore it. We get on social media and we spread misinformation, and it's very hard to convince somebody of something that they heard from a non-scientist, non-medical person. Oh, I heard such thing. You didn't hear about that person that was in the ICU with COVID pneumonia. You didn't hear them say, oh, this does not hurt. You didn't hear them say, I can breathe with this. No, you don't. What you do is you saw New York with body bags going in trucks, tractor trailers. They were storing bags of patients in the back of a truck, and it didn't have to be. And let's not let it be that way anymore. Get vaccinated. Get your children vaccinated. They can handle it better than us anyway. They can handle disease better than us, but they can handle vaccines better than us too. Do the right thing. Take care of your children. Your children will take care of you in the long run. Okay?
Hi, this is Dr. Lenore Coleman, and I am here coming to you today from Clayton State University, and we just finished up part 1 of our COVID expert panel. Today we were blessed to have Dr. Satcher, Dr. James Gavin, Dr. Suta Reddy, and Dr. Helena Bentley, all experts in their area of practice, to tell us what we needed to know about COVID and the importance of us getting tested and the importance of the vaccination. So I want to thank you so much for tuning in to part 1. Part 2 will be coming to you in separate segments, so look for both part 1 and part 2. Will be on my website at tlc-global.org. We'll also be streaming it to your Facebook page, to your Instagram, to your TikTok. So look for us, and please share this information with your friends, with your families. As you know, Total Lifestyle Change and our disease management company, Healing Our Village, we're focused on minority health. We're focused on getting people to live and not die. Our hashtag is #NoMoreFunerals. So again, thank you so much for coming today and listening for our COVID expert panel. Again, look for both part 1 and part 2, and I hope you enjoy the rest of your day.